In the study of the basic theory, we understand that the Chinese medicine has two characteristics. One is the concept of holism. The second is the syndrome differentiation and treatment variation. The formulae, the study of the formulae is actually very close related to the syndrome differentiation, especially the treatment variation. How do we treat the patient? Once we decide the syndrome, we conclude to the syndrome, how should we treat the patient? From the theory, from the syndrome, we need to establish the treatment principles. From the treatment principles, we have the specific treatment method, and then from the principles, we're going to use the formula. So this is the process of a treatment. We're going to use the theory to analyze the clinical information, and then from this analysis, we can establish the pre-treatment principles. The formula will align with the treatment principles. For example, a Qi deficiency patient. A patient suffers from Qi deficiency. The treatment principles, we're going to tonify the Qi. Tonify. We're going to tonify the Qi. That's our treatment principles. How to tonify the Qi? We have specific methods, treatment methods. We can use tonify the spleen, we can tonify the kidney, or we can tonify the lung. We can use herbal medicine. We also can use massage. We can use acupuncture. And then we use the formula. The formula based on the tonifying Qi. No matter which formula you're going to use, you need to base on the principle of tonifying the Qi. So in this situation, a patient suffers from, for example, reluctance to talk, fatigue, and poor appetite, loose stool. Then we diagnose the patient as Qi deficiency. The treatment principles, the syndrome differentiation, Qi deficiency. The principles, we're going to tonify the spleen or tonify the Qi. And then from the formula, we're going to use the four gentlemen. The four gentlemen that we have studied in the first video. The four gentlemen, as you can see here, we use the Qi deficiency, tonifying the Qi, and the four gentlemen decoction. These three are actually related to the theory, the principles, and formulae. These three are aligned to each other, and they base on each other. The principles is based on the theory from the diagnosis, and then the formulae based on the treatment principles. This will be similar in future for our treatments from acupuncture. You're going to base on the syndrome differentiation of what kind of syndrome. You're going to diagnose the syndrome first, and then you're going to establish the syndrome through establish the principles through the syndrome, and then your prescription, your formula, will based on the syndrome. For example, another patient suffers from painful menstruation, purple tongue, film coating. Then we can diagnose as the blood stasis. And then for the principles, we're going to activate the blood circulation. We can use another formula such as the 血府逐瘀汤 or 四物汤. Different formulae are aligned with different principles. Our treatment will be based on the principles. And in these slides, we use the drugs instead of using the herbs, because some Chinese herbal medicine, they're actually not herbs. They can be minerals. They also can be some animal products, although very small amount of the herbs are animal products. So we use the drugs. The drugs are the ingredients of the formulae. Once the treatment principles has been established, there are some commonly used methods that we can follow. For example, the Diaphoretic Method, Emetic Method, Purgative Method, Harmonizing Method, Clearing Method, Warming Method, Resolving Method, and Tonifying Method. These methods are commonly used in our practice. Actually, most of the treatment methods can be categorized into these 8 different categories. The diaphoretic method is actually causing sweating perspiration. This method is commonly used in the patients suffering from external pathogens, resulting in the external syndrome, especially the symptoms that are related to the skin, to the superficial level of the body, to the upper part of the body, such as the skin, the edema, headache, body ache. This method also can be used for something related to the lung, such as the patient suffer from cough, fever. We also can use the diaphoretic method. The second method is the emetic method. The emetic method mainly used for causing vomiting. Vomiting is a disease or symptom that the patient won't feel comfortable, but we also can use this method to treat diseases, especially patients with a lot of phlegm or the poisonings in intake. The purgative method is actually causing diarrhea. Causing diarrhea we can use for patients suffer from diseases related to the large intestine, the stomach. So anything related to the digestive system, we can use the purgative methods. These 3 methods, we also need to consider the nature of the diseases, its coldness or the heat. Then we're going to use the herbal method with different properties. We also can use the acupuncture points with different properties. So no matter which method we're going to use, we're going to base on the syndrome differentiation. The harmonizing method, we're going to harmonize the circulation, the qi and blood, the yin and yang in the body. How to harmonize the qi in the body? We're going to create the circulation. We're going to increase the movements. Once they move, the body can harmonize by itself. The clearing method mostly used to treat the excess syndrome, such as the patient suffer from excess heat or even fire or the heat in the blood. So we can use the clearing method. The clearing method, we can use herbal method because we didn't introduce a lot of herbal method in the general introduction of the Materia Medica. So we're not going to introduce the examples from the herbal method. But for the clearing method, especially for clearing the heat, we can use some acupuncture points. For example, we can use Du-14. Because Du-14, this point in Du meridian. Du meridian is the seat of the Yang meridian, and many Yang meridian connect to the Du-14. So if a patient suffers from excessive heat, we can prick the Du-14 to cause bleeding, reduce the heat, clearing method. We also can use the Shaoshan, Yang, so the nail. I'm not sure the number, it might be lung 11, lung 10 or 11, the one next to the nail. So you can just check the number, the next to the thumb, the nail. You can prick the one next to the index finger. You can prick to cause bleeding. This is also a kind of a clearing method to relieve the heat. Warming method. Warming method we mainly use for coldness. This coldness, especially for internal coldness. The internal coldness although the warming methods we can use for external coldness and internal coldness. For internal coldness, we can use, if you use acupuncture or massage, we can choose the points have the more warming function, such as stomach 36, zone 6. We can use the massage warm, and also the massage in general can warm the meridian. So massage is kind of warming method. Resolving method. Resolving methods mostly related to the treatments related to the pathological products, such as the qi, blood, the phlegm, especially the stagnation. So we try to resolve these products, especially the one that we can see the physical masses. Try to use the herbs to resolve the pathological products. The tonifying method. These methods are used for deficiency. You can use the reinforcing methods, the reinforcing manipulation method technique in acupuncture. You also can choose the points that have tonifying function. Again, we still can use massage. For example, again, stomach 36, zone 6, 神阙, zone 1. Zone 1 should be zone 12 if I'm not wrong, so you can just double check the number. Zone 1. These points can be used to tonify the spleen, tonify the qi. So these are the commonly used treatment methods. In one prescription, from a group of the herbs or acupoints, these individual herb or acupoint is not equally the same. Some of them are more important, some of them are not that important, and some of them have specific function, such as either to harmonize the whole formula or to guide the formula to somewhere. These different functions of the drugs, we have different names for them, such as the sovereign drug, minister drug, the adjuvant drug, and guiding drug. These titles are similar from the society. The sovereign drug is very similar to the emperor, so the direct translation will be the imperial drug. In one country, there will be only one emperor. So which means in one formula, we will aim to have one main point, main acupuncture point, or one main herb. We can have some minister drug. We need the assistance from others. So we can have the emperor can have some officers, the minister. So we got another 2 or 3 herbs can assist the emperor. We can have the adjuvant drugs to assist the formula. We also can use the guiding drug if I want the whole formula to go to the upper part of the body or to go to lower part of the body. For example, in the herbal medicine, we can use 桔梗. So if you're interested, you can search what's 桔梗. If I'm adding 桔梗 in one formula, I can guide the formula to the upper part of the body. If I add 牛膝, NIUXI, NIUXI. If I add this herb in the formula, I can guide the whole formula to focus on the lower part of the body. If I add Ganchao, Ganchao is also commonly used even in homeopathy. Ganchao. If I add the Ganchao in this formula, it can help to harmonize the whole formula. So it can help to harmonize from the herb 1, herb 2, herb 3. So the formula may work better. So these different functions of the drugs have different titles. And in future, in our treatment from acupuncture, while selecting the acupoints, we also need to think about the different functions of each point. If you think in this way, you won't have like tens of or 20s of needles on one patient, because our treatments always the less the better. Because if you use the less needle, the body of the qi can focus on one or two. If you use a lot, the effect won't be good. And also, if you use a lot of needle, you put anywhere, this is also not following the principles of Formulae. The principle of Formulae, you need to consider, you need to decide which one is the sovereign acupoint, which is the minister acupoint, which is the adjuvant acupoint, and the guiding acupoint. Although in one prescription of the acupuncture treatment, it may not include all of them, especially the guiding. You don't have two. It depends on the condition, but you need to decide which one is the main point, which one can assist the main points. So you need to decide and simplify your treatment. Sovereign drug, the herbs, to treat the cause or the main symptom of the disease, which have the greater potency and large dosage. When you see from this definition, in future in our acupuncture treatments, you can use the main points. You may keep longer. You may have more manipulation on that point. For example, if I use 5 points on both sides, I can manipulate more on the main points. That's the thinking from the Formulae. Although we use the herbal medicine here, we also apply in acupuncture. If I use masturbation, I can apply the heat longer on the main points, because this is the most important, the main symptom or the main cause of the problem. The minister assists the sovereign drug, strengthen the effect, treating the accompanying symptoms. The adjuvant drug also assists the sovereign drug as well as the minister drug. The guiding drug is the one we use in the formula if we want to guide the formula into a specific area. Previously, we have used the example to guide the formula into the upper part of the body. We also can use the meridian. We can guide the formula into specific meridian, such as we use the 相腹. And then we use the 相腹 process with the vinegar, because vinegar is sour. And then we use the 相腹 process with vinegar in this formula to guide the formula into the liver, because the sour is the taste of the liver, and the 相腹 also can enter the liver meridian. So that's the function of the guiding herbs. That's when we study the Chinese materia medica. We introduce the nature, the 4 properties, the warm, hot, or cool, cold property, the nature. We also have introduced the meridian tropism. So they have specific tendency to go to specific meridian. This is the guiding drug. The guiding drug we don't use a lot. In one formula, we normally use one guiding drug, or maximum two. We don't use a lot. That's how to make the formula simple. Always remember the simpler the better. In 黄帝内经, it describes some examples of different formulas. For example, it describes that in one formula, we can have one sovereign drug, two minister drugs, or we can have one sovereign drug, three minister drugs, and five adjuvant drugs. We also can have two sovereign drugs and four minister drugs. So as you can see, these are quite flexible. Doesn't have to be one or two, but no matter which type of the formula, you have to decide which one is the most important, which one can assist the sovereign drug. We use the 麻黄汤 as an example. 麻黄汤 is the most important formula in 伤寒杂病论. 三奥汤汁 developed from 麻黄汤 by removing 桂枝. So the only difference from 麻黄汤 and 三奥汤 is 桂枝. 麻黄 still the same. So the same 麻黄. 杏仁 we still have 杏仁 甘草 杏仁. We move the 杏仁 to the minister. We use the 杏仁 as the minister drug. As you can see, because of removing one minister drug, the actions of these two formulas are different. 麻黄汤 is good at inducing sweating. 三奥汤, the function of 三奥汤, there's no inducing sweating. Because 麻黄汤 can induce sweat, so it can use for bacterial syndrome with no sweat. In different formulae, sometimes the changes of the ingredients may affect the function, either in change the functions of the whole formula or strengthen some functions of for specific purposes. For example, 麻黄汤, 麻黄家族汤, 麻黄汤, the sovereign drug, minister drug, 桂枝, the sovereign drug, 麻黄, adjuvant drug, 杏仁, and the guiding herb, 甘草. In 麻黄家族汤, the only changes here is the 白术 for the minister drug. For 两白术, 两 the units in the Old Chinese. When you add 白术 for 两, it's similar to 60 grams of 白术. You change the function. Because 白术 can strengthen the spleen function, can tonify the spleen. Once the spleen has been tonified, the spleen function has been tonified, it can be used for dampness. So 麻黄家族汤, compared with 麻黄汤 and 麻黄家族汤, when adding the minister drug of 白术, it strengthens the function of this formula for the dampness. There's one formula, 小柴胡汤, recorded in the 伤寒杂病论, the classic. This formula is widely used for 少阳 disease because this formula has the function of harmonizing 少阳, so mostly used for liver and gallbladder problems. It is described in the clause that this formula can be used for patients suffering from 太阳 disease, especially 太阳 stroke after a few days. The patient feel hot and cold alternately. The patient it presents as poor appetite, nausea, vomiting. The patient also may present as oppressed chest and irritation. In this situation, we can use 小柴胡汤. Below the description of the 小柴胡汤, the author, Zhang Zhongjing, described that several situations. We're going to introduce one of the situation. He says that if the patient presents as thirsty, we're going to remove 半夏. We're going to add 天花粉. That's another 2 herbs. 半夏, mainly for clearing the phlegm. 天花粉 can relieve thirsty. So as you can see the description here, once the symptoms changes, especially not the main symptom, but the accompanying symptom change, we can adjust the adjuvant drug. And in this situation, we can focus more specifically on individuals. So if this patient presents as thirsty, we're going to remove 半夏. We're going to add 天花粉. 天花粉 can be used to relieve thirst. As we mentioned previously, that's the sovereign drugs. They are the dominant drugs that focus on the main cause or the dominant symptoms or the pathogenesis of the situation. So the most important herbs in this formula, it must be the high dose. And also, there shouldn't be a lot of important herbs. If you got a lot of important herbs, that's not important. So it's very similar to acupuncture treatments. You can have 1 or 2 dominant acupoints. That's your sovereign points. You can have some points that assist the sovereign points. But sometimes if you change the dose of the herb, function change, the dominant change, even with the same group of ingredients. For example, 小承气汤, 厚朴三物汤. When you see the ingredients, you see they are exactly the same. 带黄, 枳实, 厚朴. These 3 herbs in 小承气汤, there are only 3 different ingredients. In 厚朴三物汤, there are also 3 ingredients, and the ingredients are the same. What's different is the dose of each ingredient. In 小承气汤, 带黄4两, 厚朴2两. In 厚朴三物汤, 厚朴 8两, 带黄4两. So when you see here, 厚朴三物汤 almost 4 times more than 小承气汤, the dose of 厚朴. When you increase the dose of the 厚朴, the 厚朴 become the main herbs in this formula, become the sovereign herb. And the function of this, you're going to change the function. Promote the qi flow. That's the function from the 厚朴. Relieve constipation. 小承气汤 mainly for the heat. When you see this example, you will also understand that in our acupuncture treatments, with the same group of acupoints, if you change especially the manipulation technique or your focus, for example, you focus on point 8, you use a lot of time, you increase the time of the manipulation techniques, you keep 1 point for 3 to 5 minutes, and then in the other situation, with the same group of points, but you choose point B, Then, to have a longer manipulation technique, you may change your purposes, the function of this group of acupoints. So that's something you need to think about, even with the same points. When we see from this perspective, you will understand that during our needling technique, we have introduced many needling techniques, many manipulation techniques in the practicals. When you understand the important points, the minister points, the assistant points, you will understand this in our treatments. Those techniques, especially for the points that required strong sensation, we're going to focus on the sovereigns and minister point. So that's the logic in a formula. Different dosage forms of the prescription also may affect their functions. For example, 理中丸 and 人参汤, when you see the ingredients, they are exactly the same. The dosages are also exactly the same. The only difference is the dosage form. 理中丸 is in a pilled form. 人参汤 is a decoction. When we use different dosage form, the function may change. When we understand this from this perspective, when you apply acupuncture prescriptions, you will understand that even with the same ingredients, the same acupoints, when we apply different techniques, such as reducing or reinforcing, on the same points, their function may change. The result, the efficacy may change. Or more obviously, the same points you apply with acupuncture or massage, you may change the function of the treatments. You also may change the results of the treatments. Thank you for your attention.